Plantar fasciitis, short-term and long-term things you can do to treat it. Plantar fasciitis, short-term. When I say short-term, that means this is not supposed to be done as a indefinite solution you keep repeating or increasing until the pain goes away. This is only something to be done until it starts feeling better, then you start tapering it off. This isn't something you're supposed to do forever. This is a method that I was taught back in the day, inflammation. So there's some degree of inflammation in there, which is why it's called plantar fasciitis, right? If you've heard of the itis. There's always a varying degree of inflammation. What you can do for that is there's plenty of non-steroidal anti-inflammatory drugs. People will try, like Advil, Aleve. There's ice, even elevation can reduce inflammation and swelling. Compression is not a bad option. So these are some of the things you can do to decrease the inflammation or just the pain that you're getting. Next thing you want to do for the short term is increase support. Anything that substitutes the function of the plantar fascia, and the function of the plantar fascia, let's say you have a nice pristine arch here. Plantar fascia connects right here, runs all the way down to your toes. So if you were to bend your big toe about this direction, that would bring your heel forward and tighten everything up. That's the function of the plantar fascia, is to keep that arch ready to go when you need to push off of your foot. And when you're pushing off, when you go to take a step and your toes upward. So anything that will go under there and augment that position, like an arch support, you notice will have a bow to it, just like the shape of your foot. So we'll call those insoles. Support. The reason I write support here is because you can't get the insoles that are very soft and flimsy, because those are just adding cushioning. They're not actually adding support. That's what I mean when I say that. So it can be either something called over-the-counter or custom. If you want something that is molded to your unique needs, then you would get a custom. But usually over-the-counter is fine. Customs are more expensive. And the right shoes. You don't need to wear the right shoes forever. Remember, these are short-term options. But shoes that also have a good heel cup. So if we're looking at the shoe itself, you want to get a shoe that does not bend and fold a whole lot. Make sure it doesn't bend in the arch, because remember, we're trying to reduce what's happening in the arch. And you want something you can't just push down and flop down on the back of the shoe. So look for something that's not bendy and floppy. Also, taping your foot. Once again, I like to tape the arch, and I like to tape up behind the leg. That seems to reduce the motion that the arch is having to do. So those are the short-term things. Remember, those aren't the long-term game. Once you start feeling better, you'll taper that stuff off. Let's talk for a minute about long-term. These are the things that are going to help keep it from coming back. Because even after you get the right shoes and everything, you can still get plantar fasciitis. And then you say, well, what do I do now? Because I already have the insoles and I got the pain again. So the first thing you can do is increase your strength. Talked about how your plantar fascia is directly attached to your large toe here. It's also attached to your lesser toes, but mostly to this big one here is the most important part. So if you strengthen your toes, that's what you want to do. Just get a piece of fabric, put it on the floor, and it's going to be kind of weird to imagine, because it's not a motion we normally do, which is probably why this is so common, is curl something like a piece of fabric under your foot. So keep bending those toes down until you have a nice ball of material collected up under the foot, and then straighten it out and do it again. You could also improve the grip strength by squeezing marbles or something, putting them from one jar to another. That's a fun game. So if you're able to strengthen your toe muscles, which you'll feel under here, by doing that motion, you should help your plantar fascia. And then some people don't have very good flexibility, so increase the stretch. So because the plantar fascia is down in here, if you can't bend your big toe up, and they say 30 degrees is what you need, but more would be great, right? Then your plantar fascia is too tight. So you stretch that by stretching your toe, kind of like this. So if you were to squat down on the ground and lean forward on your toe, you could get a good stretch there, but you might not have the range of motion there yet. So that's for stretching your plantar fascia. Also, stretch your calf out. Your calf muscle is directly connected in your heel bone, in here, and your plantar fascia is also connected into your heel bone. So if this is pulling up too hard, then that's forcing this down too much as well. There's a great paper in the International Journal for Foot and Ankle Surgery, and what it talks about is 3 different groups of people. Some stretched, some just did other conservative treatments besides any of the stretching. Some added calf stretching, some added calf stretching and plantar fascia stretching. The group that did the best was the one that stretched their calves and their plantar fascia out substantially better. So we know it works. And then just maintain this stuff. You have to do it pretty regularly at first, but then just maintain it later. A great way to stretch your calf out is do that lunge where you lean forward. Here's your knee. Make sure your knee is also extended. Okay, got to get that knee straight and just bend over right at the ankle. And don't, like any stretch, don't do it if there's pain in there. We're not trying to solve this by causing more pain. So, short term, think, not something I want to do repeatedly. I mean, we can do cortisone shots. Some people expect to get that every few months, but I think that's a terrible way to go about treating plantar fasciitis. I think if you don't even have to do any of this stuff, you don't want to. You can go straight to this. That would be ideal. Anything to restore you back to normal would be great.